people did not understand the concept of population health and how population health related to disaster preparedness. Now, for several reasons, this is concerning. All the people were healthcare professionals, and yet they did not understand what population health was. And some of them, it wasn't that they didn't understand, they just said, we don't do it. So I want to make sure that when you walk out of here today, that you understand what we mean when we're saying population health and what is meant by a population health focus to disaster preparedness. So the field of population health includes health outcomes, patterns of health determinants, and policies and interventions that link these two. So the health outcomes of a group of individuals, including the distribution of such outcomes within the groups. In other words, it's no longer about the one patient right in front of you. It's about the community or a population or a group of people that are for some reason linked together. Make sense? We all had this in community health, right, or public health nursing course. All right. So populations are all people occupying an area. They're all of those who share one or more characteristics, and they're made up of people who do not necessarily interact or share a sense of belonging. For example, you may have the population that is the campus at the university, right? But you may not have the slightest clue or any interest in what people in business administration do. Yet, technically, you're part of the same community. So, and you may live in St. Louis. So say you live in the city, you live right downtown, you live by the waterfront, but you may know nothing about your neighbors, right? You may live in a high-rise building that has, 400 units in it. You may not know any of those people. You may be one of these people that comes in, you work all day, it's the sun hadn't come up when you leave home, it's dark when you get home, you never see your neighbors, you don't know who they are, right? That happens. But yet, you're part of the same community. So population doesn't necessarily mean that you know people. So this is a graphic figure that was in the American Journal of Public Health from back in 2003, and it's a schematic definition of the field of population health. Population health refers to the health of a population. It's measured by health status indicators and is influenced by social, economic, physical environments, the personal health practices, individual capacity, coping skills, human biology, early childhood development, and health services. What this is saying is that it's not just your genetics that impact your health. That it's your socioeconomic status. It's the environment around you. It could be the quality of the air or the quality of the water. It could be the violence in your community. So there are many things that basically impact your health. I started thinking about communities of solution to different problems, and I just did Google Maps, and you can look at Google Maps and pull up all the hospitals, and the list runs off the bottom here, but you could pull up all the hospitals in the St. Louis metro area. And you can then overlay things that you might be interested in. So we know those people that live in and around, especially in these crooks of the river, in and around these places, a lot of these are flood prone. So, we experience it on a regular basis. People live near these rivers, and lo and behold, the spring rains come and they get flooded. And we know that it's the solution. So we know Illinois is talking about building even more levees that are higher than the Corps of Engineers said they should be, which is going to do what on this side of the river? Make the flooding worse. So you have to think about these communities of people that serve the same thing. Then we have the place up here with the never-ending burning landfill with the nuclear waste next to it, and all of these people in this area that might be a community of interest, although in reality, if that nuclear waste burns, then it just means this whole big area becomes the community.
So you could add things like economics. Like, I mean, Illinois is economy's in the toilet. I don't know how they're going to build levees. So, I mean, you could overlay that onto this, right?
Yes, you can.
Okay.
That is next.
Okay.
And, we have the violence problems in downtown. And then this actually is the economics. So I overlaid over the top of all of these, the lighter the color of blue, the lighter the color, the lower the income. And the darker the pink, the purple, the darker the blue, the higher the income. So higher income, higher income, higher incomes. And then when you get over here down in the city, it's almost white. Which means these are people making less than $20,000 a year. So yes, you can do that.
And you can also possibly even do things like, where are all the bars located? Where are all the fast food restaurants located?
Yes, you can.
And that impacts the community self, right?
Absolutely.
What's the orange circle?
So the orange circle is actually St. Louis. That's actually the boundaries of what's officially the city.
Okay.
And the rest of it, is all the little municipalities that are part of the county, but they're really not part of the city. So that's actually an approximation of the area that's actually the city of St. Louis. And so you can still see the hospitals, you can see the city, but you can see as you get further out, the income again starts dropping, but you also start seeing no hospital.
And you also put down violence control. It's not crime, it's violence, right? Like
violence, just violence is what I was.
Like property damage.
And this is just an estimation looking at some of the stuff you see, and this is just a big, broad guess, because what you see is when you get out to these places, with the exception of the Central West End, which has a higher income level and also a higher crime rate. It does. And I think that they're actually probably within this, because this is Creve Coeur out here. But when you get in these really rich neighborhoods, then you see this going down. And it's, it's largely...
Like Chesterfield.
I mean, and it does go down, but there are many things that lead to violence and crime.
Interesting to me is that all the majority of the hospitals are all right there together in the pink.
So you have big barns and all those things down here, but then you have this other whole string following basically 270. You have this big string of other hospitals, and what do you notice about the income levels around the hospitals?
Money.
So yes, you can overlay all this, and there's amazing GIS, and this isn't GIS, but if you did GIS, you can do even more.
Super cool.
So then I wanted to talk to you about, we remember, everybody, please tell me you remember primary, secondary, and tertiary prevention from your community health class, right?
Yes.
So I took that and tried to apply it to disaster and public health preparedness and overlay it. And so one of the textbooks that a lot of people use in community health, there's a diagram like this in there that goes from outpatient to inpatient, and you talk about the things that you want to have happen. So in primary prevention, if you were looking at disaster preparedness, you would still want to promote, because you don't want their chronic conditions to get worse during a disaster, you might promote healthy lifestyles. You want prevention activities such as the American Red Cross goes around and puts fire alarms in houses for free. They just go around knocking on doors and saying, can we check your fire alarm? If it's not working, they put a new one in. They'll help change batteries and things like that, as do a lot of fire departments. Early alert systems. Using mosquito repellent when you go outside, right? Mosquitoes are not your friend. I mean, they're not just an annoyance anymore. They carry disease. But also mitigation activities. So the American Red Cross has the pillowcase project. You take pillowcase and you throw all the stuff in it for kids' preparedness. And so they have a pillowcase that in case of fire or disaster, you just grab your pillowcase full of stuff. It's kind of a cool little project for kids. They have home fire preparedness, community preparedness, vaccination, and then good policies in communities falls into this primary prevention, because a lot of being prepared is about the policies in your community or in your facility. Secondary prevention is when, okay, something's already happening, right? You know that the person's already got at least one risk factor for whatever it is, and you're not ever going to get rid of that. So now you're moving to secondary prevention. So you want to screen for risk factors when at least one already exists, and then do community screening and prevention of communicable diseases after a disaster. So after a disaster, what are the big risks? Waterborne diseases, diseases related to overcrowding after a disaster in shelter environments, and there are more that you might think of. So it's one of the reasons that after a disaster we go in and we do vaccinations, or we go in and we do prophylaxis for what? Hep A, right? You might go in and do things like that. And then, of course,
do we have to change these things depending on the environment that
absolutely.
You're in? So if I'm in Afghanistan, it's going to be different than if I'm in New Orleans.
Absolutely.
Okay.
Absolutely.
So I have to.
Although
take
the people that survived Katrina might tell you, no, not really. But,
right.
But yes, yeah, you these would change for every situation in every community, depending on where you are and what you're doing. All right? And then, of course, tertiary is when somebody's already sick, and now you're trying to basically treat them, make them as healthy as possible, and do what you can. So you're trying to soften the impact, meet the long-term health needs. You want adequate treatment and adequate medical management. So this is where community resilience, rapid needs assessments, and teaching about stress response during a disaster. And that's something for mental health providers. You frequently get called in to do psychiatric mental health first aid. So the Red Cross and some other organizations keep psych first aid for disasters. And so those are things that are interesting to do and to learn about. So I just wanted you to see this one and to understand it. In our focused interviews with the 13 people that had been both disaster responders and educators, only one stated that they included the population perspective in the disaster training. They really focused on the individual in front of them and how people treat individuals. And the remaining 12 either did not include population health focus in their training or did not understand what is meant, what we mean by population health focus. I'm not sure which was more alarming to me, that they didn't do it or that they didn't understand what it was. So, questions? Okay, so that's